A urologist is a doctor who specializes in diagnosing and treating diseases of the urinary system. In part 1 of this month's health check, I'm joined by urologist Dr. David Mendoza from WVU Medicine Camden Clark Medical Center to learn more about urology. Dr. Mendoza, thank you so much for sitting down with us.
Thank you, Andrew.
Of course. So the first thing that I want to ask you, pretty basic question I think for you, I know you're very knowledgeable about this stuff, but what is urology and what areas of the body do you specialize in as a urologist?
Okay, so urology is the surgical subspecialty dealing with the genitourinary tract in men and the urinary tract in women. So that would be consistent like the kidneys, the bladder, and of course the male genital system. And then in the females, it is just the urinary tract, and then the OBGYNs or obstetric gynecology, they deal with the genital tract for the women, babies and so forth, delivery.
Okay, and so I do want to ask too, what are some common, health issues or symptoms that indicate a person should see a urologist?
So some of the more common disease entities and things that we see patients for referrals are like blood in the urine. We call that hematuria.
Right.
And that could either be what we call microscopic, meaning you'd have to look under a microscope to see it, or gross, meaning you can see it with a naked eye. Other things are kidney stones and any cancer dealing with the urinary tract or the male genital tract.
Okay, and so I do want to ask too, can you discuss the differences for urological conditions that affect men and women?
Okay, so for a urologist standpoint, most of the ones that we deal with in the urinary tract are going to be similar. Kidney stones, kidney cancer, bladder cancer. Now, of course, women don't have prostates, but that's a big thing for men is prostate cancer. And of course, in the male genital system, we deal with testicular cancer. We evaluate both sexes for blood in the urine, urinary tract infections, and treat obviously for kidney stones in both men and women.
And so when there might be issues like those going on, when might be the correct time? If people are hesitant to see their urologist, when might be the best time to go see one for those kind of conditions?
Yes. So for men, urinary tract infections are fairly rare. So anytime a man has a urinary tract infection, we generally will recommend a urological evaluation. And in children too, we also treat children for the same situation. In children, if they have any urinary tract infections, we recommend a urological evaluation. Women, they're more commonly can have urinary tract infections and not have necessarily significant pathology associated with that. A typical common term that used in layman's honeymoon cystitis. Okay, so it's when that becomes a more frequent situation. We say more than 3 in a 6-month period of time.
Right.
Or if it's associated with significant bleeding, that's uncommon. I mean, you can have a little bit of blood in a urinary tract infection, but significant bleeding, you can't. So we urge those patients who have frequent urinary tract infections should definitely be referred to a urologist for further evaluation.
Absolutely. And so one final question for you here. Is there anything else you'd like to highlight or tell us about, whether it's about urology or stuff that you specialize in as a urologist?
Now, I think, from a man's perspective, they're less likely to seek treatment or evaluation, especially when it comes to their genital system.
Right.
And that delay in diagnosis, especially for like testicular cancer, can be very important. Testicular cancer doubling times of the tumor are anywhere from 7 to 9 days. So you want to seek, if you feel a lump or a mass in your testicles, if you're a man, you want to seek a urologist evaluation urgently. Typically, it's not uncommon. They will wait for a month on average before they see somebody. And that can mean a lot in their diagnosis and treatment. Absolutely.
Well, Dr. Mendoza, thank you so much for sitting down with us and sharing your wealth of knowledge on this topic. We greatly appreciate it.
Well, you're more than welcome. Thank you.
Of course. Mid-Ohio Valley, next Monday night, Dr. Mendoza will be rejoining us here on set to tell us a little bit more about urology and give some advice to people who may be dealing with urological conditions. When we come back, we'll have one last look at your forecast. Stay with us.